Okay, so my thoughts and feelings during the exercise. I think I was more nervous about just making sure that I say the right thing, making sure that I don't say anything that would, you know. And I know you can't, like, if someone's thinking about suicide, they're thinking about it, and what I say doesn't necessarily make them want to do it more. Because it's like that thought that if you talk about it, then they'll want to do it more. So I get that part, but it's still like that thought in my brain about it. So that part was a little bit difficult for me, just trying to stay out of my head about it. How easy or difficult was it to ask the questions? I think it was difficult, and maybe because of just of my belief system, it was difficult to talk about it. But I also think that, just like I said, if it's like, we're not gonna push anybody further towards it, but it still was a little bit difficult. The risk factors were that you did say that you had thoughts of suicide. You wanted to, at first, just kind of lay in bed, waste away. But then, I guess, thinking about like how long that would take, the risk factor like increased, because you're like, okay, well, then I'll just take all my medicine. And so that was definitely a risk factor. What would I have said or done differently? First, I would have like taken notes and written things down, just to kind of help for me to like guide the conversation. Because as a therapist or somebody that's doing this work, they would definitely be taking notes. But I also wish that I had, when we talked about, I'm going to take all my medication, I wish I had, mentioned in the safety plan, like, hey, let's, what do you think about having a time-released medication box, so that when it's time, the box only opens when it's time to take your medication, offering that, or even offering, maybe you give your medication to your friend Marla, and then she can kind of help you, she's there to help you take your medication. I wish I had kind of thought more about that. What feedback would you like from your partner? How did I do?
Great. You did great. Very, very natural kind of flow. You asked the right questions, opening and closing questions. I think you did fabulous.
Okay. Well, good. This was different. We did it.
All right.